The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Kristina Liu, who is your hosting family today, as we speak with Joe Sledge. Joe is the health system specialist in the business office at the Northport VA Medical Center. So thank you so much for joining us today, Joe. We have so many questions for you.
Thank you, Rebecca and Kristina. It's a pleasure to be here.
Thank you again. So let's just get right to it. You know, you hear so much about the Northport VA. It's all over the place, and you know, people know it exists, but I don't think like the general population, even so that have many people who have served really understand what exactly the Northport VA is. So if you could just kind of give us an overview of the Northport VA and who and how it serves.
Okay, I'm happy to. So the Northport VA Medical Center is primarily the VA healthcare provider for Long Island veterans, for veterans in Nassau and Suffolk counties. We have an acute care complex here at the medical center where we provide inpatient care, anywhere from acute med surgical care to acute psychiatry. We also have a nursing home, we call it a community living center, and some other residential treatment programs for veterans who are going through recovery from substances or those who are struggling to overcome the trauma of war on our residential PTSD program unit. We also have 5 community-based outpatient clinics across Long Island. In Nassau County, we have one in Valley Stream. The other one is in East Meadow. Those 2 clinics provide primary care and mental health services to the veterans of Nassau County. Basically, the concept was to bring those 2 primary services closer to the doorsteps of veterans in Nassau County. And the other 3 are here in Suffolk, Riverhead, Patchogue, and Bayshore. And basically, we're primarily service veterans, although we do have veterans who are 100% service connected by the VA, meaning they have a disability that's been rated at 100%. Their spouses and dependents are often able to use VA under a program called CHAMP VA. They're not that many, but that is certainly something that is available to those veterans.
And then, like, Joe, I think people hear this, right? And it's how do you even begin? If you are a veteran, to get connected to the Northport.
That's a very good question. That's primarily what I tried to do in my new role to get veterans. Pull over. I'm involved in outreach to veterans in the community. I think the most important thing is that veterans become aware of the programs and services that the VA has available to them. There are many veterans, I think, who have not accessed VA healthcare for quite a number of reasons. Some of them being that they think that they may not be eligible. And what I say to that is, unless you absolutely know why, what VA offers and who's eligible, you really should call or come and see us and find out, because there are most honorably discharged veterans are eligible for VA care, and the VA has an awful lot to offer. And I would encourage every veteran who has not availed him or herself of VA services to at least find out if they're eligible. And that starts with filling out an application. It's a form you can find online. If you contact me, I can mail you one or email you one. And it's a VA form 1010EZ. And basically, it's a very simple form. It's literally 3 pages. And actually, the 3rd page is a signature page. And ask you basic information about yourself, your military history. You have to supply some proof of your military service, and that's for most of us veterans. That's in the form of a DD-214, which is what the Department of Defense issues you when you separate from active duty. It's a very important form. So I would encourage anyone who has not availed him or herself of VA services to find out by contacting the medical center, eligibility department, by going online. The VA has so much information online at va.gov.
It really does. I know, because when I was doing the research, it was really, it's a great
If you go to
thing.
va.gov, you can find out an awful lot about what the VA has to offer. It's certainly worth every veteran's time. Some veterans who were found ineligible in the past because of factors like income, and it's still a factor, but people's circumstances change. So if you were once told you're not eligible because your income exceeded the threshold that allows VA to treat you, if things have changed in your life, if you've retired, maybe you've lost a spouse through death or divorce, and your income is low, your household income is low now, that could open up the window for you to get VA care. And that's certainly something worth exploring. There are many benefits to using the VA, actually.
Joe, so, we're Project Independence. We serve seniors. There was plenty of World War II veterans here. And a lot of them came back home and got jobs, became attorneys, accountants, and were able to get their own insurance, and maybe never really had the need to utilize VA, services or insurance. But, let's say, now they're in their 80s. They've never really applied, but the services are are appealing to them now for many, many reasons.
Yes.
And is it ever too late to apply for VA services?
No, it's never too late to apply for VA services. And your point is very well taken, particularly with regard to senior veterans. As you'd expect, there is a lot of emphasis on making sure that our servicemen and women returning from war are met and welcomed, educated on their VA entitlements, and given all the services that they need to make that transition from military to civilian life, and to overcome some of the difficulties they may have had because of their military service, traumas, physical injuries, emotional injuries, and get those services. But we have a whole population of veterans who served in the Vietnam War, in the Korean War, and even still some World War II veterans who served in the first Persian Gulf War in the 90s. There are a lot of veterans on Long Island who fall into those populations of veterans, and there is something for those veterans at Northport VA or in our community clinics, and by an extension through the Veterans Benefits Administration. One of the things I think seniors are most interested in these days is if they all want to stay. Everybody wants to stay in their home as long as they possibly can. Nobody wants to go into a skilled nursing facility.
Right.
Obviously, some of them we have to if there's no one to provide care for us, which is why it's important for your listeners to know about a VA pension benefit known as aid and attendance. And they could go to the VA website again, type in the terms aid and attendance pension, and they will read about how certain qualifying veterans can get financial support for in-home care provided by an aide, or if they're staying in an assisted living facility, they can get paid a pension to offset the cost of their assisted living stay. And it's a very important pension benefit that is available to wartime veterans and their spouses. This is one of the areas where spouses is entitled to an entitlement. The basic criteria is the veteran has to have served during a period of war, and they have to meet certain medical and financial qualifications. But the information is available on the VA website called Aid and Attendance Benefit. In addition to that, veterans who use the Northport VA or one of our community clinics may also qualify for VA paid home health aides through our home health aid program. And for the most part, it's not as rich as I would like to see it, but the VA does provide most veterans up to 16 hours a week of in-home health aides if they qualify. And I would encourage veterans to do that. Another really valuable program for seniors is our caregiver support program. for throughout my career, which is it's going on 30 years in the VA, if I hear one thing a spouse tell me, and predominantly mostly, women have said this to me as they've aged with their husbands, I can't lift him, and I can't move him when I need to, and it's a challenge, and I'm going to get hurt, or I have been hurt. That's why it's important for a veteran to find out what the VA can provide them, and not only in terms of an aid, but there are some in-home supports as well, equipment, modifications to the bathroom. There's just it's, if you don't ask, you won't know. Now, the VA doesn't do everything; it can't do everything, but it does an awful lot to help veterans and their spouses as they go into their senior years.
So, in kind of the same light, when if say the veteran passes and the spouse is still there doing well, what access would the spouse have to the VA benefits? And would they have access if that veteran had not kind of applied for it or didn't need it throughout the year?
Well, to be really clear, that's a great question. To be really clear, most spouses of veterans are not entitled to VA care. The VA is primarily for the veteran, whether it be him or her, who served on active duty and enrolled in and is enrolled in for care. The benefits for spouses are rather limited. The one I mentioned just a moment ago, aid and attendance, is one that is sticks out in my mind as an important one for spouses, because again, it's not just for the veteran; it's for the veteran, a wartime veteran, and his or her spouse. And the only other time a spouse would receive a benefit or an entitlement through the medical center is if they were part of that CHAMP VA program and they were below the age of 65. Because at 65, then they transition to Medicare, and unfortunately, they're no longer able to use VA healthcare. But it is, if there is a veteran out there who right now has a service-connected disability rating of 100%, and isn't aware or hasn't taken advantage of CHAMP VA entitlements, they should contact the VA regional office, or they can contact the VA Medical Center, and we can educate them on CHAMP VA. But again, that is for veterans who have service-related disabilities that have been determined by VA to be 100% disabling.
Joe, do you find it like, I don't want to say difficult, but the younger veterans, is there fewer or less younger veterans that utilize the VA than, say, the older generation?
Well, there was a time when in my former VA job, I was able to keep track of the populations of veterans we were serving by period of service. I would say it's safe to say that the largest population of veterans currently using VA right now at Northport are Vietnam era veterans. But we have seen a considerable number of veterans who have served in the first Gulf War and in Iraq and Afghanistan, and in other dangerous spots, after 9/11, post 9/11 hotspots. And so we are seeing a mix of veterans from very young to very old. And, you have to tailor the care and the approach to each population you're serving. Sure. I reflect on my own experience trying to get a COVID test when early on in the pandemic, and, everything had to be done by a computer. Well, I'm not the most computer literate person. And I thought, my goodness, what if, our older parents or young aunts and uncles who are in their, maybe 80s, or how do they navigate this computerized world? It's really challenging. So we have to continue to try and meet the veterans where we can. Younger veterans are largely electronic. They're online. They're far more savvy with computers than most of us ever hope to be. But we can't get rid of paper, and we can't get rid of people answering phones and being, there in person for people who don't have computers or are not comfortable with computers, or, it's not their medium to communicate their care needs. Yeah.
If Otto were here, he'd be talking a lot about that too, because he's very, pro technology for seniors. So, we do a lot of that stuff with Project Independence. But, there is that, certainly still a population that they're just not going for it. So,
well, no, it is important to get people to utilize, you want the most people to utilize all these wonderful services. You kind of have to find that, as you were saying, that happy medium,
Yep.
and
we have to meet people where they are. And, we do that in a number of ways. As I said, many times I'm emailing an application to a veteran or to a veteran's family member on behalf of a veteran, instructing them to fill it out, send it back, you can fax it back. But for some veterans or their spouse, I'm still dropping a hard copy application into the mail and waiting for a hard copy to be received. So, again, we have to be where the veterans need us to be.
Yeah.
And Joe, what is the best phone number someone should call to, get in touch with the VA?
Well, we have our main line is 631-261-4400. If a veteran is looking to enroll for care or to check the status of enrollment, they would, when they call the operator, when they reach the auto attendant, they could punch in 2655 or 2660, and that will get them to either central intake or eligibility. And we can then work on determining whether, one, we have an active application, whether that application is in process, whether that application has been successfully entered and a determination about eligibility has been made. Normally, when a determination of eligibility is made, the Veterans Health the Health Administration sends out a welcome letter and a packet.
You know what, Joe? We have to take a quick break, and we'll come right back to that.
Perfect.
We've been talking with Joe Sledge from Northport VA, and you're listening to Project Independence in You here on 88.1 FM and WCWP.org. We'll be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Kristina Liu, who is the radio show producer, and we are your hosting family for today. We're speaking with Joe Sledge from the Northport VA, and we're just learning so much about it. And Joe, you are an ultimate resource, that is for sure, for the VA. But I know one of the things that Kristina and I always wind up talking to our guests about, because it's there, is what was it like during COVID for you? What was those 18 months and still ongoing? How were you able to operate and get in touch? We're a little bit different. We were able to do all of our programming on Zoom, and we have social workers and community nurses who make phone calls and check-ins and things like that. And we learned a lot, just like when Sandy hit, we all learned a lot of stuff.
Yeah.
Well, so what was that like for you? And did you guys also make changes that you're going to continue doing today, like we here at Project Independence will be doing?
Yes, as a matter of fact, we had to adjust, like everyone else, to the unfolding pandemic and all the challenges it presented to us. One of the things that we significantly increased was our video connections with veterans. We were doing primary care visits and mental health visits and group visits over this type of communication, this Zoom or Skype or face, whatever the medium was that veterans have access to. We were trying to meet veterans exactly the same way you and I are speaking right now, so that we did not lose touch, that we could stay on top of medical issues, medical concerns, stay connected to veterans. In fact, we were trying for years before the pandemic to increase video connect appointments through our telehealth program. And one of the new things was we began having first-time primary care appointments for veterans through Zoom or through this type of video connection. And it was challenging. It's not ideal in some cases. You want to have a physical, want to take everything in as a provider, I'm sure. But it was out of the caution for the veterans and for the staff that this medium was engaged or used. And it was very successful in allowing us to stay in touch with patients. We also increased our outreach through electronic means. Outreach was typically, show up at an American Legion Hall or some sort of an event in the community, and you discuss what benefits are available to veterans. Well, we lost that, so we had to increase our outreach via email and social media. So that is one of the impacts of the COVID-19 pandemic. I believe every effort was made to protect the patients, protect the staff, to minimize the risk or the spread of the virus. The VA has been one of the sites issuing the COVID-19 vaccines. And I want to say sometime around March, worked with a number of representatives of the community and the government to expand the vaccination program to include caregivers of veterans and spouses of caregivers, so that we were making the country safer through this program.
Yeah, it's pretty amazing, that it kind of catapulted everybody to utilize technology, even though we all wanted to. We weren't necessarily prepared for it, but we had no choice. So,
right.
And it is a great venue, and there's so many things that we, at Project Independence will continue doing. And one of the things that, happened too, as you probably experienced, is, you have very active seniors, I'm sure you have veterans who drive themselves out there, and they're, active and take part in things. From, doing that to then them becoming almost like homebound because they can't go out. So I think it actually helped agencies and services like Project Independence and the VA to be forced to also learn how to be better at serving homebound people.
Mm-hmm.
They're because, as you know, they're the hardest population to kind of find out who they are. We did a lot of stuff on North Hempstead Television, which is a government channel that we never did before, and we reached people we were never able to reach before. Those who didn't have computers, they have a television, and they were able for the first time to see a lot of the activities that Project Independence does, whether it's a fitness class or even this radio show is on, and they learn so much information. They then get in contact with us, and we learn about them and, their needs. So it was kind of, just very interesting how what we learned from, kind of tragic situations and
right.
And it helped us to kind of improve our services, and it's very interesting.
Yeah, it is interesting. And you touched upon people who are active. One of the heartbreaking of many heartbreaking things that come along with this pandemic is that we had so many active volunteers who would show up and help veterans, some of them fellow veterans, some of them these are just wonderful citizens who wanted to give back by working in a VA medical center as an escort or a greeter, or do some other function that, would supplement the work of the VA to care for the veteran. And it's heartbreaking that, the pandemic has not only impacted the VA that way, but so many other agencies where volunteers were not, out of an abundance of caution, able to continue to work in that capacity. I hope that very soon we will see the resumption of volunteer services and volunteers showing up and doing their part here at the VA Medical Center, and again across Long Island and across the country. Volunteerism is such a valuable part of what we do in the VA. We rely so much on our volunteers. It's been a big impact. And I'm sure, and we haven't even touched on how deeply it is, we won't know for a while
Yeah.
just how much it's been an impact.
So if somebody wants to volunteer at the VA, would they call that same number? How would they get in touch with anybody specific?
Yeah, we have a voluntary service office right now. They are, because volunteers have to be screened and evaluated each year. They're actually not taking on new volunteers at this time. Once the all clear for the pandemic is reached, or we're given some green light to bring volunteers back to the medical center, we will be able to then recruit and enroll more volunteers. And we have a very large volunteer contingent. We have volunteer drivers, we have the DAV, we have Nassau County. Nassau County, by the way, was fortunate to be able to resume employing a lot of safe practices, limited transportation to the VA with patients, and it's been a godsend. One of the other things that we learned doing, to do differently, because there was an impact on our volunteer transportation program, the DAV. We began to recruit or solicit from those who are willing to help Uber gift cards, so that we could schedule rides for veterans with travel hardships who were not eligible for VA paid transportation. And I'm very grateful to all of the donors across Long Island that helped us with our Uber transportation program when we really needed it the most. And the veterans are going to be eternally grateful for that support.
Project Independence also provided transportation to the Northport VA, I think, to get their vaccines. Mm-hmm. So, everybody tried, everybody really wanted, to help out. And the one thing, talking about volunteerism, a program that, Kristina really catapulted during COVID, was Friends Calling Friends. So like, you have these volunteers who no longer can show up. So, we would link them to people who have similar interests. And I think what happened was, we turned out, correct me if I'm wrong, Kristina, but we actually had more volunteers than people that really wanted, that requested it. So it was, you had to shift that too.
Everyone, and that's what's nice, right? We always on this show try to find kind of like the silver lining of these horrible things, and it just shows you too, in the community, so many people were trying to find kind of creative ways outside the box to still connect to people, and as we were talking, it made me realize, and I have to give this, the Vets Committee for North Hempstead, kept saying, please mention it. So it's so important to mention that in North Hempstead this year, we're doing the Veterans Donation Drive, which is helping the Hero Help Hunger Project. It's going to run through December 31st, and it's donations of supermarket and pharmacy gift cards to really help veterans, combat the food insecurity. And the Northport VA will distribute the gift cards to veterans receiving support services and those who need them. You can call 311 or 516-869-6311 to get all the specifics on where to mail the gift card to or drop it off or whatnot, through the town. But I think this is a really nice way to, it's a safe way. And like I said, normally we have these big donation drives where there's canned goods and stuff, but it's a different time we're in right now, but we still want to help out. So I think it's nice to have these gift cards that can be, given out at the VA.
For years, I can't even count how many years, Judy Bosworth and the town of North Hempstead's veterans leaders have rallied around the Northport VA Medical Center to take care of the veterans here. Every holiday season, like, as you say, boxes upon boxes upon boxes of toiletries, clothing, personal care were delivered. As you mentioned, because of the pandemic, we took a turn last year, and true to form, not wanting to stop something so good, Judy and the veteran leaders said that they would again adjust to these gift cards. Yeah. And we've been doing the Hero Hunger Help Project at Northport VA Medical Center probably for the better part of, I want to say 20 years. It's coming up on 20 years. And again, it's a program that's quite valuable. It's sad that it's necessary, but it's necessary because there are veterans who are struggling financially and having a difficult time putting food on the table. So many veterans suffer from food insecurity. And so we wanted to make sure that we did our part. The fact that Supervisor Bosworth and the veteran leaders of the town of North Hempstead have taken up this additional cause, in addition to all the work they've done in the years past, is just, I guess, indicative of the good people of the town of North Hempstead, and we're eternally grateful. You've got another organization in the town of North Hempstead called the American Legion. The auxiliary there, and I'll say in a person, Pat O'Brien, and her friends and colleagues have also embraced the veteran patients at Northport VA, not only those in the hospital, but those who we serve in the community. And they have made a positive and lasting difference in the lives of veterans, particularly with regard to food insecurity, and most recently by participating and really funding in a very large part our Secret Soldier Santa program. So I can't tell you, and veterans are very reluctant to take help. They're very proud, as they should be, but it's our job to let the veterans know that they are the ones who put their lives on the line, put their lives on hold, that if they're going through a tough part now in their lives, it's our obligation to help them get through this part of their life. Many of these veterans come back at later in life, having, gotten acclimated back to civilian life, gotten jobs, moved on with their families, have come back to become donors themselves. It's really a beautiful thing.
One of the other things that was wonderful in the reverse way too that the VA did for us was prior to COVID, we were the recipient, mostly at Seat Clinton G. Martin Park, of the Veterans Mobile, mobile vans, where they provided incredible health services, from physical therapy to general testing and
dietary. Yes. So that has been an unfortunate consequence of the pandemic, that because it's a mobile unit and the confines are so small, it was unsafe. And even now, until we get past these latest variants and such with the virus, it's not really the safest place to provide care in such a close setting. I hope that very soon we're past all of this and we can resume some of the wonderful things we've done over the years for the veterans across Long Island.
Right.
Yeah, and that's what I think, it's to be hopeful, because we get calls about that all the time, because, everyone loves the mobile aspect of things. It created a convenience.
Oh, yeah.
So that is something that I do believe, and I'm going to stay hopeful. I think that things will, kind of work our way slowly but surely. Let's get through this winter and hopefully, embrace spring.
I hope
we
you're
actually
right.
have to take a break right now. You've been listening to Project Independence and You at 88.1 FM, WCWP.org, and we will be right back.
So I get this call from my grandma, and she's like,
"What's a podcast, and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. Those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, along with Kristina Liu, your hosting team for today. We're speaking with Joe Sledge from the Northport VA and just getting a lot of information. And I know over the break, Kristina, you had a question you wanted to talk to Joe about.
Yeah, what we, we were just talking about just, veterans that we've come, in contact with. And that's something over the years in working with Project Independence. When we've talked about services, we have our veterans caseworker through Project Independence who, no matter what your age is, works with veterans. It's not just a senior service. And from speaking with her also, there's a lot of residents and veterans residents who don't think they qualify for so many services because they might not have been in direct combat. So Joe, what are they, do they, what's the, the question, the answer to that question?
It's a great question because it touches on what we were talking about earlier in the show about, veterans not being, maybe having heard myths about what would make somebody eligible. So one need not have served in combat to be eligible for VA. I know that there is a perception among some people that the VA is for war veterans or or only war injured veterans or poor veterans, and that is not the case. As I said early on, if you served on active duty and you have a DD-214, and even if you didn't serve on active duty, we also help veterans who come to us with other than honorable discharges, with under certain circumstances. We can assist them in appealing to the VA to find them eligible for care. Sometimes it works, and sometimes, unfortunately, it doesn't work. But when in doubt, they should apply and find out. Any veteran who has not applied for VA healthcare because they thought it was for some other veterans, or they don't want to take it away from somebody. I've heard that so many times over the years, which is a wonderful thing. It's a typical veteran trait. I don't want to take it away from somebody else. You're not taking anything away from anybody else. If you're entitled to a service, if you're entitled to a program, then it's there for you, and it should be there for everyone in its fullness. And so by applying for VA care, you're not taking anything away from somebody else. You should really fill out the application. Unfortunately, in the past, I've heard that some veterans, in knowing about the financial means test, have asked staff, which I'm very reluctant to even get into discussion about financial means test, because fill out the application, let the process do what the process does, and let us know officially whether you are or aren't eligible. You can't do eligibility in thin air. We need that application. We need the DD-214. We should do it properly so that we can, out of respect for the veteran and this process, tell the veteran, yes, you either are or you aren't, and this is why. No guesswork. So some veterans say, well, I don't want to fill out an application. It's literally 2 pages and a signature page. So it's not a lot to it. And it really is worth veterans' time and effort. And, sometimes, we hear from veterans who have had some difficulty with the VA in the past. And they say, well, I'm not going to the VA.
Right.
The VA is like every other healthcare organization, every type of human care organization. I find it to be wonderful for the most part. And every once in a while, there's an issue or a person who doesn't represent the VA as it should, and it turns people off. I wouldn't let that person or that issue sidetrack me from an entitlement I'm able to receive because I'm a veteran, and we should all have that thought process.
Joe, just a quick question about the application. I'm just curious, what's the turnaround time? So if somebody does fill out the application, how long before they know if they qualify or not?
We try to get all the applications done within about a week to 2 weeks time. During the pandemic, we've been, unfortunately, like everyone else, been impacted by certain factors, but our goal is to get it done as soon as possible. And, we're fielding calls from people who say, well, I sent in an application a week ago or a month ago, and we're able to track it and find it. And sometimes it's a case of veterans eligible, but they haven't gotten the welcome packet from the Health Eligibility Center. And so we have to let them know, could you send the welcome packet? Again, it's not a perfect system. It's a good system, but anything could be improved. But the bottom line is, if a veteran hasn't availed him or herself of VA and they think they're entitled, or they believe that they are entitled, I strongly encourage them to fill out the application. And if they've done it in the past and they were found ineligible and they think things might have changed, which is getting me to my next point about changes in the rules. For many years, veterans who served off the blue waterways of Vietnam, many of them were found ineligible for care because they weren't considered exposed to Agent Orange. Well, now that has changed through litigation and legislation and rules. So now blue water veterans are considered eligible for care. Veterans who served at Camp Lejeune from the 1950s to the 1980s, who were exposed to the contaminated water supply, the VA was, the government, I should say, and the VA were very slow to a point in recognizing the health impacts on those veterans, on those Marines and their families. Thankfully, several years ago, that changed. And basically, if you served at Camp Lejeune during this period from 50, I think it's 57 to 50 to 53 to 87, you are eligible for VA care because of presumed exposure to the contaminated water. If you came to VA before that rule was passed, you may have been told you earned too much money. My advice is come back and apply again.
Okay. No, I think that's great advice, and it's what we always say with our program too, is that, it can't hurt to sign up, right? Because you can have all these access services that you may choose to use or not use, but just getting that initial process, and I know, as I had mentioned earlier, our veterans caseworker, Gail, I know a lot of people are hesitant to keep calling, but what's great about her is that she can do the follow-up and help you. Some people have difficulty, even having.
Oh, absolutely. Again, it's a bureaucracy, and there are some processes that are complicated, and there's some applications or some procedures that you would say, well, can we simplify that?
Right.
Again, my point is, there are resources. People should try to avail themselves. And again, I mentioned the caregiver support program. Mm-hmm. The program coordinator is a social worker named Mary Kelly. People can call the medical center and ask to speak with the caregiver support coordinator. Her extension at Northport is 4108. And if we have senior veterans who are struggling and they need help, Mary and her team can help. Some of the people who are caring for their veteran loved ones may be entitled to get a stipend for taking care of that veteran. So they could speak to Mary about that, or her staff. But Mary can be reached at extension 4108 at the medical center. And she's a wonderful, wonderful person whose sole purpose in life, I think, is to make veterans receive the fullness of VA care.
Joe, one of the things.
Wonderful. Yeah. Go ahead, Beck.
I was just going to say, one of the things that we kind of noticed with Project Independence with caregivers is a lot of times they don't define themselves as a caregiver. They're just the spouse. They're taking care. So they don't really understand, that they're a caregiver and that there's respite programs and support at the VA, that kind of a thing, So like when I remember talking to a senior when I first started with Project Independence, and she's like, oh yeah, I'm doing this for my husband and that. And she was able to come out while her daughter came over just to come to a program with Project Independence. I said, oh, you're his primary caregiver. I mean, you can, you could probably get some respite. And she goes, no, I'm not. I just, it's my husband. I said, well, who takes care of him around the clock, And it was like an aha moment for her, but also for me. I'm like, well, they don't understand that there is services for the caregiver. I mean, I think it's a lot more noticed now, but do you I'm sure you find that too. People don't even realize that they're the caregiver and that.
And sometimes what we find is, even if last night I was speaking with a veteran who's married. He's not necessarily homebound, but struggling physically. And I reached out to him because another veteran asked me to call and just check in. And so I reached out to his providers and some other folks here at Northport to say, could you reach out to this veteran to see what we can do for him and his wife, because they're not advocating for themselves, because, they're not, again, it's a generation, maybe it's a generational thing. I don't want to bother anybody. I don't want to, it's a lot of talk. And so, you got a couple of different schools of thought. So I think caregivers, it's a tremendous burden, and one that they accept joyfully because they love their spouse, but there are resources to ease that burden. Right. And it's important because then you can sort of, sometimes you can become the 1,000-year-old man or woman taking care of somebody, and you're not your same chipper self. And so, there is help.
And I think it's somewhat empowering when you when someone who doesn't realize that they're a bona fide caregiver of their time and not able to do the things they once did, because they are now this person's primary caregiver, when they understand that and that there's support for what they do, it's very empowering. And I think, we at Project Independence, and also, maybe the VA is, and anyone that actually serves seniors or people with disabilities, are do programming. Are you a caregiver? How do, this is what there is help for people who are the primary caregiver of a loved one. And you just happen to be that caregiver because it's your family.
Right. And honestly, I was thinking about, as you're speaking, for veterans or their loved ones who've maybe hit a brick wall at the VA with something. I do want to mention that we have patient advocates.
Oh,
so if
wonderful.
somebody's hit a brick wall, if somebody feels that they've done everything they can to resolve an issue and it's not being resolved, they can contact the medical center and ask the operator to connect them with a patient advocate. And the patient advocate's role is to try and resolve the matter as quickly as possible. Sometimes it can be solved. Sometimes it can't be solved for maybe many reasons, but there are people at the medical center whose job is to help veterans navigate through perhaps difficult situations or maybe perceived or real lack of response on a particular issue. So for your listeners who are maybe hitting a brick wall with a particular care issue, they can reach out to the patient advocates by simply asking the operator to transfer them to the advocate.
See, and that's what I think is so important. Beck and I obviously were very familiar with, certain services at the VA because we've worked with you guys, we've done programming, we're always advocating for your services. And it's just so amazing because I find myself, as I sit here, I'm learning about so many services that I didn't know that, the VA offered. So I could only imagine, the person out there, what you can benefit, just by calling that main number. At the end of the video, we'll have it up at the end so people could actually visually, see it as well, because I think it's so important. Because, and I would say the battle is finding out, there are services out there, and it's just getting connected to them that can change your whole.
Sometimes it's getting connected to the right person,
right,
or people, or department. For me, I find it easier if people want to contact me, to email me, and so if you want to put up my email address,
yes, absolutely.
It's joe.sledge@va.gov. I find that's the best way because I'm on the floor out in central intake or eligibility or someplace else, and you're not always sitting at a desk waiting for the phone to ring or being available when the phone ring. I find I can be at a computer anywhere and read an email. So if somebody wants to reach out to me, I can initiate a contact. And I'm happy to make the appropriate referrals.
Absolutely. And then there's one more thing I want, because throughout this whole interview, I was, you kept mentioning the DT 214.
Department of Defense.
You don't have that. Let's say, you came back and.
It's a very good question. So for veterans, for older veterans, if you don't have a DD 214, you can apply for one. You can do it by hard copy. It's like a regular form. It's a standard form 180. And you can go to the computer if you're able and you have a printer, download the standard 180. Or you can go to the U.S. Archives website and they have an electronic way of requesting your military discharge paper. I can tell you that throughout the pandemic, I've been hearing from people who are trying to get their DD-24 that some of them are having better success at that than others. If for some reason you can't get through or aren't hearing, for some veterans, there is a way we can do an electronic search. It is not, I wouldn't even say it's 50% successful, but we'll try anything to help a veteran determine eligibility. So we can do what's called a HINC, and I don't know what the acronym stands for, but it allows us to use a social security number, date of birth, and someone's name to see if anywhere in the VA we can determine eligibility. Unfortunately, again, that doesn't work for the older veterans. Veterans who serve post 9/11, we actually can just go into a computer program and pull up a DD-214 most times. But that's how a veteran would get a DD-214.
Because that's what I was wondering, how do you go about that?
Because you have to prove military service. Believe it or not, there have been hopefully relatively few. Some people who fill that application never served, but so I mean, it's a shame, but that's why the government requires we have proof in order for us to enroll somebody. That's just the way it is.
No, of course. And then, I mean, that makes perfectly good sense. And that's something I also know that our caseworker has helped, a lot of our older veterans who, through the years, that piece of paper has, ended up in the atmosphere. And
yes. Oh, and one other thing, that piece of paper not only would help them get their VA healthcare, but it's very important if the family's intent on having that veteran interred or laid to rest in a national cemetery.
Right. Yes.
Very important.
Mm-hmm.
No, that's great. And that's what I think, call 311 if you're in the town, or, 516-869-6011, and we can get you connected with our veterans caseworker who can work with, and just kind of help figure out a way to find that. Because I know she's done that for a lot of different, veterans.
Joe, so you mentioned you're how long with the Northport VA?
Next August, I'll be with the VA 30 years.
30 years. How does that happen? What are you, 39, 28?
Yeah, right. I served in the Army right after high school. I have a military family. All my brothers, my father, everybody served in the armed forces. And I actually wasn't even looking for a job. And my father's like, Joe, don't you think I just graduated college? You're already 4 years behind your peers. Go look for a job. And I came here as like on a lark. I thought they're never going to hire me. And here I am almost 30 years later.
What did you start as?
I started in public affairs, and I ended up being in public affairs for about 25 years. And my heart was really in this role, health system specialist. So a director at the time, knowing that, and basically sensing my desire to kind of move into a different realm, I became a health system specialist. And I spent some time in our nursing home trying to help our veterans in the nursing home and our staff maybe improve some systems, improve some processes. And I think we did a really good job. And unfortunately for me, I was needed other places, and I've moved around a bit since then. And that's why I find myself this last year supervising health administration section, which again, we're trying to make improvements every day here at the hospital.
Yeah, I mean, we're hearing good things. How many beds are at the facility?
Oh my, let's see. We have 153 nursing home beds. We have, I believe, how many beds? About 100 and I would say about over 100 hospital beds, but we also have nursing home beds.
Right.
We have 2 acute psychiatric units, 2 medical surgical units, a residential post-traumatic stress disorder program, a residential substance abuse recovery program, and our nursing home. And our nursing home is broken up into, traditional nursing home, skilled nursing care. Mm-hmm. And we have a locked geriatric nursing home unit, and a unit where we provide palliative care to veterans at the end of life. Mm-hmm. And, it's our goal here at Northport VA is to treat veterans with respect and dignity and help them heal and be comforted. And, I think for the most part, we do that every day. Obviously, there's always opportunities to improve that everywhere. But it's really an honor and a privilege to work for the VA in my mind.
Wow, it's tremendous services there. It really is. And, Joe, perfect timing. Thank you so much for joining us on.
Yeah, and I thank you for your service, in all realms of life,
Thank you. Really appreciate it. And I thank you, and I thank all of you in the town of North Hempstead for what you do for veterans and their families. God bless you.
Right back at you.
Thank you. Right back at you. We'll be back with Talk of the Town with Kristina Liu and myself. You've been listening to Project Independence and You on 88.1 FM and WCWP.org.